Welcome back, ladies and gentlemen. You're still watching the Nile Cruise, and now we're going to talk about a healthier Egypt, reviewing the 2025 medical milestone. As we begin 2026, it's time to reflect on a transformative year for Egypt's healthcare landscape. 2025 was a year of unprecedented milestones, from the expansion of the universal health insurance system to the inauguration of the world-class medical cities. These achievements present more than just numbers. They represent a new standard of care for every Egyptian citizen. And to shed more light on this topic, we are delighted to have with us here Dr. Magdy Adly. He is a leading expert in health sector development. Welcome to the show, Dr. Magdy.
Welcome. I'm very happy and great pleasure to be with you this night.
Dr. Magdi, if you could describe the progress of the Egyptian health sector in 2025 in one word, what would it be?
Okay, if we can make a brief for the health sector in 2025, we can name it the year of continuity of the efforts of government.
Okay.
The year of the push for more progress in the field of healthcare system.
Mhm.
The year for application of a new technology. The year of application of digital transformation. The
Mhm.
year of AI application of in healthcare system.
Mhm.
The year of a great and mega conferences,
Yes.
because we in 2025 we watched the great conferences like the conference of BHDC 2025, which has been held in November 2025,
Mhm.
and it was a very great event. The attention was like 46,000 of from different all over the world. There is a lot of speakers, official speakers.
Mhm.
All are talking about the health issues, the population issues.
Mhm.
All of that has been happened in 2025,
Yeah.
and and even the 2025 has witnessing a lot of milestone points, like the budget of healthcare system.
Mhm.
There is an increase of the budget of healthcare system, healthcare in Egypt, like by like 25%
Yeah.
increase in the budget of health.
Mhm.
And we watch we can say that the budget now is around like 496 billion Egyptian pound. A lot of them has been pushed for or has been put for more innovation, for
Yeah.
more building infrastructures of hospitals, more infrastructures in healthcare units,
Yeah.
universal insurance system.
Yeah.
Expanding of universal healthcare insurance system
Mhm.
was one of the most important things that government put it as an essential
Target.
goal or target
Mhm.
for this year.
Mhm.
And even as I told you, the strategy of digital transformation, which has been launched 2024 up 2020 29.
Mhm.
A lot of agreement with the WHO and the international partnership.
Mhm.
A lot of infrastructures of medical factories for self for medicine to be enough for our countries, and the other will be
Self-sufficiency.
self-sufficient. Sorry,
Yeah.
for self-sufficiency. And now we have like 90% self-sufficiency of medication in
Okay.
Egypt.
Mm.
And we are targeting now for more exportation of the to the African continent.
Mm-hmm.
By the way, African continent import like 89% of its needs of medicine
Mm-hmm.
from outside,
Mm-hmm.
and Egypt as a country,
Mm.
Arabic country
Mm.
or African country,
Mm-hmm.
sharing with like 27% of that imported medicine for African continent.
Okay.
So we are push all, for all sides of health corners,
Yeah.
and even but the main point, as I told you, was the how to the expanding of or coverage of universal health insurance to cover all citizens, all Egyptian citizens. The government planned to cover like 85% of population 2026 by 2026 2027,
Yes.
and the rest will be applied by up to 2030 as matching with the vision, Egyptian vision 2030.
Yeah. Dr. Magdi, how many new governorates were officially integrated into the Universal Health Insurance, the UHI system, this past year?
Yes. Look, UHIS has been started by 2018,
Mm-hmm.
and has been applied officially in 5 governorates:
Yeah.
Bor Said and South Sinai, Luxor, Aswan.
Mm-hmm.
I think there is another governorate,
Mm-hmm.
5 governorates.
Mm-hmm.
This was the first phase of the UHIS, and now the the people who are having benefits from that system now, like 6 million citizens. uh, we this year 2026 will apply it officially in another 5 governorates. First phase was 6 governorates.
Yes.
Second phase is 5 governorates, and maybe we added a million citizen, million population citizens, which is Alexandria mainly, which can we can launch the UHIS in Alexandria starting by 2026,
Mm-hmm.
and that will be great, because Alexandria have a high number of population.
Yeah.
This is a challenge for the government and the Ministry of Health.
Health. Mm-hmm.
Egypt and Mr. President, in fact, make a file of health as one of his priorities of his
Yes.
agenda,
Mm-hmm.
and we pray for God to be succeed in that file, mainly.
Yes, we hope so. Dr. Magdi, what specific medical city or hospital project in 2025 do you consider the jewel of the sector?
Look, there is a lot of hospitals and has been established
Mm.
according to the plan of application of UHIS
Mm.
and health care units. But the one I think which is you can call it a jewel is New Giza Hospital, Universal Hospital,
Okay.
because this hospital is not only a hospital. It has a lot of beds, a lot of clinics, a lot of operating theaters.
Mm.
In the same time, it is a castle of education, because it
Yes.
is belonging to the University of
University.
New Giza.
Yeah.
So it has two jobs: one for treatment of citizens, other
Is it
job.
free? Is it free or
Y-
is it private?
Yes, it's free, by the way,
Okay.
but not something called partnership between government and the private sector.
Okay.
but it provided good services.
Of course.
In the same time, it's an educational
Hub.
institution
Mm-hmm.
for the students of a New Giza.
Mm.
Has been built in Medi Hills downtown, Hyde Park, sorry, Medi Hills, Hyde Park in New Giza.
Yeah.
It's a community which is containing hospitals, containing factories of medicine, containing clinics, containing a lot of things. So it's
Mm.
very nice hospital.
Mm-hmm.
In the same time, the one also we can call it as jewel is the hospital of a new capital.
Okay.
This is a big hospital prepared according to the recent uh, global guidelines,
Mm.
having a recent medical devices,
Mm-hmm.
having very good staff of doctors and nurses,
Mm-hmm.
a lot.
Of course.
So we are going on a right platform right now
Yes.
with we increase the investment in the file of health.
Mm-hmm.
We built hospitals applied and matching the guidelines of global guidelines.
Mm.
We make agreements with WHO. By the way, there is a lot of agreements with WHO for 5 years, starting from 2024 up to 2028 for increasing or covers the UHIS,
Yeah.
for enhancing the healthcare system, for enhancing and accelerating digitalization of health,
Mm-hmm.
for many things, by the way.
Yeah. Dr. Magdi, how has the digital transformation project reduced waiting times for surgeries, in particular in
Uh-huh.
public hospitals?
Okay, digital transformation now is the topics which is used in advanced countries, mainly in the health sector,
Yeah.
because that consumes the time, that gives you an accurate diagnosis, that gives you an accurate and good healthcare services.
Mm-hmm.
uh, I can give you an example. There is something called decision at the state expense. Before this decision takes like 1 year to be reached to the
Yeah.
patient. Now, digital transformation, shortening that time,
Mm.
make a communication with the citizen and patients very easily,
Mm-hmm.
make a good data and accurate data reach to the decision makers,
Mm-hmm.
so you can build on that digital transformation with accurate analysis, with accurate statistics,
Mm-hmm.
uh, that will help for acceleration of surgeries,
Mm-hmm.
that will help in the accuracy and accuracy of diagnosis,
Mm-hmm.
because when you make an accuracy of diagnosis, you will you will find out the, ca- the product or the service will be accurate,
Mm-hmm.
and the operations 90%, 95% of the operation will succeed.
Mm-hmm.
Even the highly accurate surgeries, like cerebral surgeries, like heart open surgeries, like which is an accurate surgeries.
Yeah.
So it has a lot of benefits. Digital transformation has a
Mm.
lot of benefits. Even when we applied AI, even, and that is this is the global trend now is
Mm-hmm.
AI in health sector,
Mm-hmm.
and robot doctors. You hear about robot
Yes.
doctors, and there is in China they designed an entire hospital with AI,
Mm-hmm.
from the machines, from doctors, from nurses, that will be the shape of the health in future, by the way. And Egypt usually like to be side by side with the recent technology, because you know that we are the first country of the continent, African continent, who have the abilities, who have the knowledge, who have the medical education advanced. So we are looking for that projects as a future project for the nation and our generations.
Yeah. 2025 saw a push for drug sovereignty.
Uh,
How close is Egypt in being 100% self-sufficient in essential medications, Dr. Magdi?
that, as I told you, now we have a self
Sufficient,
sufficiency of
yeah.
medication.
Hmm.
In last 10 years or 9 years, we have little numbers of factories manufacturing medicine, but right now we have almost like 179 factory which has producing an essential medication, cosmetic medications, uh, even veterinary medications, and we are looking for the localization of manufacturing and the transfer of the technology of manufacturing here in Egypt of all most of medication all over the world. Even we have a cooperation with the international companies for that purpose. As I told you, 91% we have self-sufficiency, 91% of medication. Even we have factories for drug derivatives, sorry, blood derivatives and plasma derivatives, and these even chemotherapy factories. And by the way, these was costing the state a lot of billions of Egyptian pounds.
Of course.
So all of that keeps it's very important for even the Egyptian economics.
Yeah. Dr. Magdi, you want to talk more about training and what are the steps taken in 2025 to improve the training and the retention of our doctors and nursing staff?
Look, for training points, as I told you, there is many conferences have been held in held in 2025, like that conference of BHD C 2025 and others. These conferences is a very nice chance and a very nice platform for exchange the expertise between
Yeah.
the foreigners, doctor and Egyptian doctors. Even the Ministry of Health sometimes send doctors and nurses outside Egypt to have the experience from Western countries or from America or from advanced countries in field of medicine, so that these will be a very good point. They have the experience. They come inside the country and they transfer it to another doctors. Even we have an institution. You can say like Dr. Magdy Hospital is
Yeah.
a very big castle for training good doctors in some majority like cardiology. So training in Egypt nowadays is very important, and because the first element who can keep the organization, entire organization succeed is the human being doctors, because this is the first number,
Yeah.
because these people who diagnose the disease,
Okay.
the treatment is starting from diagnosis of the disease.
Okay. Dr. Magdi, what is the primary healthcare goal that Egypt is set to achieve by the end of the coming year?
I think there is a lot of goals, as I told you,
The
for
health
the
sector.
government that expanding the UHIS for all over the state,
Yeah.
or like 85% of the state. the enhancing of digital transformation infrastructures, enhancing the medical care services,
Yeah.
the public medical care services, by
Mhm.
the way, to have high sufficiency or high citizen satisfaction
Mhm.
or impact feedback from the health services have been provided to the citizens.
Yeah.
So I think this is the main goal of the government in the next in that year 2026.
Yeah. Dr. Magdy Adli, a leading expert in health sector development, thank you very much for
Thank
joining
you.
us today in Nile TV.
And very nice to meet you, and very nice
Thank
for
you.
you for your program.
Thank you.
Thank you.
Ladies and gentlemen, we have more after the short break. Stay with us.